2019 and 2021, Elsevier carried out 2 global surveys with 3,715 physician participants to answer questions about physicians' use of online resources, one before the pandemic and the other at its height. The survey revealed interesting trends and changes in physicians' use of online resources and social media before and after the COVID-19 pandemic. This 4-part video series will discuss those findings. In Part 3, we discuss the importance of staying connected and how the 2021 survey showed that COVID-19 restrictions have consolidated the shift to digital content. Medical congresses and conferences have always been important sources of information on medical advances. Our responding physicians identified their preferred channels of information for new medical developments as professional conferences, symposia, and newsletters from medical associations, with 64% in the 2021 survey identifying professional conferences or symposia as their first or second preferred channel of information about new medical developments, and 46% in the 2021 survey identifying newsletters from medical associations as their first or second preferred channel of information about new medical developments. Our survey also found that in 2021, the popularity of medical society websites for congresses increased by more than 10% compared to 2019 in France, Germany, Spain, Italy, Poland, Brazil, and China. Dr. Spate noted that while there was previously a delay between new findings shared at a congress and the subsequent publication of the data, they often happen simultaneously now.
At the last ESMO, there were some interesting news for the treatment of metastatic prostate cancer that were reported and were published the same day, and the day after, I had changed my practice because it was concerning medications that were already available.
However, the COVID-19 pandemic saw the postponement or cancellation of many medical conferences, leaving a gap in connection between medical professionals and forcing them to seek information elsewhere. While some went online, others looked to medical societies for connection. Medical society websites were considered a preferred source of information by 63% of physicians globally.
I do use content from different society websites. It really will depend, though, on the situation. So, for example, I will turn to the American Academy of Dermatology website because I know that they're hosting the American Academy of Dermatology guidelines for psoriasis or for eczema. I could find it in PubMed. I could go to the peer-reviewed literature. I could go to the Journal of the American Academy of Dermatology website and find it.
In the absence of in-person conferences and seminars during the COVID-19 pandemic, many organisers took events online. For example, the International Society for Sexual Medicine, ISSM, ran a series of monthly webinars on a range of topics during the pandemic. ISSM President Dr. Anna Maria Giraldi, Professor of Clinical Sexology at the University of Copenhagen, said, "The pandemic has pushed us to think of new ways of reaching our members, and this is a very effective way to achieve it." Such webinars were already popular as per the 2019 survey, but no doubt largely due to the pandemic, their popularity rose significantly by 2021, with 59% of physicians using webinars as a resource. The increase in popularity was quite high in the EMEALA region, with a 29% increase in 2 years. In some European countries, the increase was particularly dramatic, with the popularity of webinars rising by more than 30% in the UK, France, and Poland. Now that you know more about how doctors stayed connected to relevant information during the pandemic, please join us for our next chapter, How Doctors View and Use Social Media, where we will discuss the specific ways that doctors are leveraging social media to stay informed, connected, and up to date. For additional information or for our complete white paper report, you can always contact the Elsevier Pharma and Life Sciences Solutions team.